I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, "I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs." That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, "I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs." That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine. But you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in front of—
Do you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. You're Senator begging your product. You do not know what you're talking about.
Submit for the record.
Let's have a little bit of order so that you can get
Madam
your
Chair,
question
I'm
and we can get
I didn't ask for a response yet.
I understand
I'd like
that.
to lay out the predicate of my question before I'm interrupted by the witness. He should have some respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you have said about the vaccine, and the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but, you know, the lake is probably toxic, and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. Nobody's going to swim in that lake if that's what you say. And so I want you to acknowledge that when you say you support the measles vaccine and then go out and repeatedly undermine the vaccine with information that is contested by public health experts, that is not supporting the vaccine.
Do you think lead poisoning in children is a significant concern?
Is lead poisoning
in children a significant concern?
It's a extremely significant concern.
Thank you. Then I would like to know why your department has effectively shut down the very program to address lead poisoning in children. The city of Milwaukee requested assistance from the CDC to help the city respond to lead poisoning cases tied to public schools. 6 schools have been closed, displacing more than 1,800 school children. The request for federal assistance was denied because of lack of staff. The entire childhood lead poisoning branch has been fired. In the words of a Milwaukee mom, it really sends a message of, you don't matter. I don't know what you would say to parents who must now test their children for lead and deal with school closures. But do you intend to eliminate this branch at CDC, yes or no?
No, we do not.
Okay. Because you cannot tell us that you want to make America healthy again when you are willfully destroying programs that keep children safe and healthy from lead poisoning. Congress dedicated $51 million in funding for this particular program. But when a community asks for help to prevent lifelong complications for children, and there is no one there to pick up the phone, and it's not because this program is ineffective, it's because you fired the entire team whose job it is to support communities like Milwaukee.
We have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita, as you've indicated, than any other country. Is health care a human right? Are we making America healthy when so many people cannot afford to go to a doctor, when 68,000 people a year die because they don't get to a doctor when they should? Is health care a human right? Will you work with us to guarantee health care to every man, woman, and child in America?
Well, I think you're asking two different questions. You're asking a philosophical question about whether it is a human right, like a constitutional right. As an attorney, I would say that it's not a right of a kind that we otherwise enshrine in the Constitution, because healthcare costs your neighbor money. If I smoke cigarettes for 20 years, I make that choice, which is my choice.
I don't mean to, I don't have a lot of time, so but I am here.
If you're asking me a philosophical question, I gotta, give you a thoughtful answer.
Within 30 seconds.
Yeah.
It's a problem.
So, it's not like freedom of speech, which costs, everybody.
But every other country, Mr. Secretary, every other country guarantees health care to all people as a right. Should we, as Americans?
The objective is to get Americans the level of health care that they want, the choice which Americans want. Americans
they don't want the choice to be uninsured.
Well, but
they don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance to other insurance sources.
Do you believe? Okay.
And what I would say is, I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to health care. The question is, how do we get there? Obamacare is not working. It is not working. And this is the...
Sorry to interrupt you. All right. The reconciliation...
My job is to try to make it work.
All right. I have limited time. The reconciliation bill that is now being worked on in the House will come to the Senate. As it stands right now, cuts Medicaid in the Affordable Care Act by more than $715 billion, which the CBO has estimated would eliminate health insurance for 13.7 million Americans, and also raise co-payments for millions of others, is throwing 13 million Americans off of the health care they have, poor and working class people, keeping America healthy.
Well, I haven't seen that number. I've seen the number 8 million. And here the people, the cuts are not true cuts. The cuts are eliminations of waste, abuse, and fraud. And I can go through. I can go through the people who will lose it. There are a million people,
I really don't mean to be rude, but as you know, I have a very limited amount of time.
You asked a question, I'm going to answer it.
Well, yeah, I've got a bunch of questions that I would like you to answer as well. All right, we talk about austerity, doing more with less, but in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with proposals from the president. The president
No, I'm talking
is
about
not
the
making
congressional
them-
bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for overtime.
$235 billion by through the estate tax.
How many billionaires do you know that are making overtime or making any part of the tips?
$235 billion. Look, it's a big bill. There are a lot of provisions in it, but you cannot deny
National bill.
the top 0.2% will get $235 billion in tax breaks while we cut Medicaid.
Do you think HHS should employ anyone who has endangered the health of children?
No.
You hired David Geyer to lead autism research at HHS, an individual who fraudulently posed as a doctor and gave dangerous medications and medical tests to children with autism. According to the state of Maryland's investigation, David Geyer, who has no medical license or training, gave hormone blocker injections to children with autism who were as young as 8 years old, which the Maryland Board of Medicine said poses a substantial risk of harm. Secretary Kennedy, yes or no, will you fire David Geyer?
First of all, what you're saying is not true. And we did not hire David Geyer to manage autism research at HHS.
So
And
what is his job? What is his job then?
You just said some very defamatory
Well, no,
things about a person who, by the way,
so let me just be clear for the record.
those charges, Senator, I am going to correct the record on
No,
this
let
because
me
you
just
have defamed
let
a
me tell you
person.
what the record says, and then I will hear from you. Last week, when Mr. O'Neill was here in his confirmation hearing, I submitted for the record the charge that the state of Maryland laid out. Now, if you'd like also for me to submit to the record with unanimous consent today, the findings of the state of Maryland, which fined him $10,000 for practicing medicine without a license. He does not have a medical license, and for providing and instructing and giving children hormone blockers. That is what the finding of the Maryland Department, the state of Maryland, its medical licensing board was. And I'll submit that for the record, I hope with unanimous consent.
I'm assuming that you don't know what I'm about to tell you, or you wouldn't say something that was so dishonest. You may or may not know that David Geyer sued the American.
Oh, I do know that. I do know that. That doesn't
And that
change
he
the
ran-
findings,
and that- and
nor does
that-
it, nor
that
does it change
finding
the
was
experience of the parents
But that
who
finding-
testified.
That finding was reversed by court, and he was awarded $5 million.
That is not true. Now, let me ask, so I just want confirmation. David Geyer is still at HHS. I wrote you a letter
David
about this a
Geyer
month ago, and you have not responded.
Well, I apologize for that. That's our bad. And I will respond. But David Geyer is not managing autism research.
So what is his job?
We never said that he was.
What is his job at HHS? This is somebody who gave parents the impression that he was a doctor and gave hormone blockers to children as young as 8, telling them that hormone blockers would somehow magically help their kids with autism.
His father was.
His father is a doctor, but he is not. And his father was not in the room and did not, and he faked his father's signature according to the State Board of Medicine.
And that ruling was overturned by a court. So what you're saying is just wrong. It's just a lie. And they were actually, the court said that the Maryland Board of Physicians was guilty of actual malice in fabricating those charges against David Geyer.
Well, we will pursue this.
Yeah.
And I will submit for the record.
So do you want to know why we brought David Geyer in?
Sure.
Because it wasn't to run autism research. In 2002, the CDC runs a vaccine safety data link, which is supposed to be the vaccine information for the biggest HMOs that are supposed to allow CDC to have a surveillance system for vaccine injury. It's a backstop system. The CDC will not let any physicians in there to look at it or any scientists, independent scientists.
He's neither a scientist nor a physician.
Right. Congress ordered CDC to open it to the Geyers. So they are the only scientists who have ever been in there.
But again, Mr. Geyer is not a scientist. Thank you.
Independent scientists.
Okay, Senator Hessen's time's expired, but before we move on, did you have a unanimous consent request that I heard in there, Senator?
Senator Hawley, I did. A unanimous consent request for the printout of the website that shows Dr. Geyer is not Dr. Geyer, that's his father, Mr. Geyer, is employed, and also a unanimous consent request for the finding from the Board of Licensing in Maryland.
Without objection to both of those. And now, Mr. Kennedy, before we get to my time, do you want, if you'd like to finish your response, go ahead, and then I'll recognize myself.
David Geyer is the only living independent scientist who's seen the VSD inside. There's been a lot of monkey business with the VSD, including allegations of fraud. And he was hired by an independent contractor not as an HHS employee, but by an independent contractor to look at the documents that we were getting to the VSD to see if they conformed with what he saw between 2002 and 2016. And that's the only reason that he was brought in, to see if there was, there's so much information that has disappeared from that database.
You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
Didn't fire any working scientists, Senator.
That, sir, is not true either. But nonetheless,
but it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
Which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACF. It's ACF.
No, actually, it's in Health and Human Services. Yeah. And I think, and again,
no, they're all within Health and Human Services, but the subdivision is ACF.
No, actually, the name of the
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also,
as I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
We have, right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So it doesn't exist right now. It's been dismantled. That is a fact, that particular division, what you plan to do in the
There's 42 divisions on maternal health. We consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a part,
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the ones, the programs that you've cut.
You're unfamiliar with my agency, that NIH and CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with the
know that.
researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that.